Joining us right now to talk more about it, Dr. Timothy Quinn, Medical Director of Quinn Healthcare in Mississippi. So, Dr. Quinn, what exactly is President Clinton dealing with here?
Well, right now, things are looking a lot better. But on last Tuesday, according to the reports that I received, former President Clinton complained of fatigue. He was evaluated by his medical team. He was later admitted to the hospital with a diagnosis of a urinary tract infection that had spread to the bloodstream, resulting in a condition called sepsis. Now, most people that have this condition, it's potentially deadly. I mean, some of the symptoms that former President Clinton could have complained of would be increased heart rate, increased respiration, meaning breathing hard. He could have had a decreased blood pressure. He could have had fever and the fatigue that he complained of. The good news is his white blood cells, according to the reports, have continued to go down. And that's basically in his bloodstream, the cells that fight the infection. And this is showing that his body is responding well to the IV antibiotics he was given along with the IV fluids. So his prognosis is looking a lot better. And the latest report that I saw this morning revealed that he may be switched to oral antibiotics and discharged as early as today or the next 24 to 48 hours.
Well, that's very progressive. I mean, that's a good sign. But as soon as I heard the word sepsis, that's a very serious blood infection. Can you talk about that?
Well, definitely, yes. I mean, according to the CDC, 1.7 million Americans develop this condition every year. And the fact that former President Clinton is 75 years old, that gives him a major risk factor. He also has a history of heart disease, which was very worrisome in that with sepsis, you can result in that decreased blood pressure and that rapid heart rate. The fact that he had the bypass surgery in 2004, along with the stents in 2010, reveals that his heart could have been somewhat compromised before he even developed this condition, which is very worrisome because it could have resulted in his heart condition revisiting as far as being compromised or in jeopardy. So it's so good that his medical team was right there. They acted very quickly and got him the treatment that he needed.
Right, especially in light of those pre-existing conditions and those previous surgeries. Dr. Quinn, thank you so much. We'll be following the former president's condition very closely.